Mm-hmm. Ooh, 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 ooh. Yeah, I'm gonna take my drugs to that old town street. I'm gonna sell till I can't no more. I'm gonna take my drugs to that old town street. I'm gonna sell till I can't no more. I got the perkies in the bag, Zannies in the stash. Police looking for me, but you know they'll never find. Perkies in the bag, Benzos in the stash. Police looking for me, but you know they'll never find. Cause can't nobody tell me nothing. It let me sell you something. Can't nobody tell me nothing. Cause this episode's poppin'.
Welcome to Druggie Nation. We're the bridge between everything pharmacy and pop culture. And now, let's check in with your connect and America's favorite pharmacist, Emmanuel Vogirin.
Wow, he really did a remix to that. Wow, that remix fire though, right? Okay, so if this is your first time listening to the Small Doses podcast, this is basically where I focus on a particular condition and also talk about relevant pharmacy and health news of the day. But today's topic I'm focusing on is on diabetes, the beatus. Let's get an overview of that. Now, diabetes is a disease where basically your blood glucose or blood sugar levels are too high. So glucose comes from the foods we eat, right? And insulin is a hormone that helps the glucose get into your cells to give them energy. So we need glucose for energy. Now, glucose is really important to our health because it's a significant source of energy for the cells that make up your muscles and tissues. It's also your brain's main source of fuel. There's two types of diabetes, type 1 and type 2. Now, with type 1 diabetes, your body does not make insulin. With type 2 diabetes, however, which is the more common type, your body does not make or use insulin well. Without enough insulin, guys, the glucose stays in your blood. Both types can be due to genetic and environmental factors, but weight, how much you weigh, is not believed to be a factor in type 1 as it's thought to be in type 2. Think more so environmental factors like inactivity, age, weight, and actually race as risk factors for prediabetes and type 2 diabetes. Now, it's unclear why people of certain races, the government, including Black people, Hispanics, American Indians, and Asian Americans, are at a higher risk of diabetes. A quick side note, guys. So when I was in my last professional pharmacy here, a pharmacy school, I had the chance to actually do an internship at a Navajo tribe reservation hospital in New Mexico. It was like near Framingham, New Mexico. And literally every patient there had diabetes. It was crazy. I mean, the access to healthy foods was so poor. It's like a food desert there to get fruits and vegetables. I was there for 6 weeks and it was a chore. It was really hard to go to the local grocery store to get healthy food options. And I had access, obviously, to more resources than I believe most people that lived on the reservation actually did, right? So that was very upsetting to see that. That reminds me, I didn't forget, guys. Well, sort of did. But I will have to tell you guys some wild stories I had during my final school year of internships. I was one of the lucky students. I had great preceptors, great pharmacy preceptors. They let me do anything pretty much. So I got away with a lot of shit. But one day I'm going to tell you guys those stories. As Drake said, just wait on it, guys. Just wait on it. So back to diabetes. You can also have prediabetes, which is, I just mentioned, and that can lead to type 2 diabetes. This means that your blood sugar is higher than normal, but not high enough to be called diabetes. Having that prediabetes actually puts you at a higher risk of getting type 2 diabetes. Pregnant women can also get diabetes, which is called gestational diabetes. Now, what's good to note is that both prediabetes and gestational diabetes are reversible just by eating and exercising. And then after the baby is born, your levels, should be back to normal. Over time, having too much glucose in your blood can cause serious problems. It can damage your eyes, your kidneys, and your nerves. Diabetes can also cause heart disease, stroke, or even a need to remove a limb. You see a lot of instances where people have had to have their foot removed due to diabetes. All my culture folks out there know the movie Soul Food with Vanessa Williams, where one of the main characters, Big Mama, had to get her foot amputated because she had diabetes and she did not do a good job of taking her medications, taking care of herself. Now, blood tests blood tests can show if you have diabetes or not. We've all at some point heard about the A1C test or commercials that say check the A1C with the glucose meter and the test strips. So the A1C can also check on how well you are managing your diabetes. Goes without saying, exercise, weight control, and sticking to your meal plan can help control your diabetes. You should also monitor your blood glucose level and take medicine as prescribed. Now, some symptoms of diabetes. Diabetic symptoms can vary depending on how much your blood sugar is elevated. Some people, especially those with prediabetes or type 2 diabetes, may not experience symptoms initially. In type 1 diabetes, symptoms tend to come on quickly and be more severe. Some of the signs and symptoms of type 1 and type 2 diabetes are as follows. Increased thirst. Not thirsting for the ladies out there, just increased thirst for water, right? Frequent urination, extreme hunger, unexplained weight loss, presence of ketones in the urine. Now, ketones are a byproduct of the breakdown of muscle and fat that happens when there's not enough available insulin. You can also have symptoms of fatigue, symptoms of irritability, blurred vision, slow healing sores, frequent infections such as gums or skin infections, and vaginal infections. Type 1 diabetes can develop at any age. However, it is more likely during childhood or adolescence, so when you're younger. Type 2 diabetes, the more common type, can develop at any age, but it's more common in people who are older, especially older than 40. Okay, so I'm telling you all this stuff about diabetes, but how can I prevent me from getting diabetes? Prevention, guys. So type 1 diabetes, unfortunately, cannot be prevented. It's more genetic, like I mentioned before. But for the other three, prediabetes, type 2 diabetes, and gestational diabetes, we can do these things as follows. We can eat healthy foods. Now, choose foods that are lower in fat and calories and higher in fiber. Focus on the fruits and vegetables and whole grains. And you should get a variety of these things so you're not bored and doesn't become like a chore to you to eat healthy. You don't make it a chore. You have to make it like fun to eat healthy. Get more physical activity. Let's try this. Like say for 30 minutes of moderate physical activity a day. Walk around your neighborhood in the morning or when you get back from work. Ride your bike. Well, if you have a nice neighborhood, walk around your neighborhood. Ride your bike, swim laps. If you can't fit this into a long workout, break it up into the day. In the morning, do a little workout, 15 minutes. Lunch break, do a little workout, walk around, 15 minutes. When you get back from work, just, do a little walk around the neighborhood, do a little exercise for like half an hour. You want to try and lose excess pounds. So if you're overweight, losing even 7% of your body weight, for example, let's say 14 pounds if you weigh 200 pounds, that can reduce the risk of diabetes. Don't try to lose the weight during pregnancy, though. Talk to your doctor about how much weight is actually healthy for you to gain during pregnancy. You want to keep your weight in a healthy range, and you can motivate yourself, right? By remembering how much healthier your body and mind will be when you eat healthy and exercise. And also you want to keep your feet too, right? Okay, now for some interesting news I stumbled upon recently. First up, we got an update on Denver legalizing, some kind of legalization of magic mushrooms. Now, this one is really interesting and important. I covered the story a little while back on one of my small doses episodes when it was being discussed in Denver, whether or not to actually put the measure on the ballots. On a ballot in Denver, it's called Initiative 301, and it passed on May 8th. So Initiative 301 makes the possession, the use, and cultivation, which just means growing, of psilocybin mushrooms among people aged 21 years, right, and older, right, and over, the lowest priority crime for law enforcement in the city. It does not legalize mushrooms, but it does prohibit Denver from spending any resources to prosecute people with magic mushrooms. They're not saying, hey, everyone, let's get mushrooms, let's hallucinate together, hey, let's have a party. No. I think we need to distinguish that what Denver/Colorado are saying with this vote is that we need to decriminalize a plant that is showing promise via research to actually have medical benefits. If you want to find out more about magic mushrooms, you can listen to episode 3 of Druggie Nation podcast and also find information on the U.S. News and World Health Report's drugs section. I mean, there could be a magic mushrooms pill in a few years from now, guys. So I would definitely continue to monitor all things magic mushrooms and keep you guys in the loop. The next story I thought was important to mention was something I heard while listening to NPR the other day. NPR Boston, to be exact. Ooh, you listen to NPR. That means you were smarty, huh? So it's about everyone's favorite topic, opiates. There's a disparity in opioid treatment. Oh, surprise, surprise. So this one caught my attention because it's about race disparities and drugs access. We all have heard by now about how the opiate epidemic just decimated communities all over. Blue, black, white. Every community has been affected all over the country, okay? And trust me, the drugs don't care about the user's race. But apparently, those prescribing a treatment for opiate addiction do care about the race. So white drug users addicted to heroin, fentanyl, and other opiates have had near exclusive access to Suboxone. Suboxone is a drug that lowers someone's cravings for opiates and reduces the chances of a fatal overdose, a person ODing, right? That's actually according to a study from the University of Michigan, which is going to be published in a journal called JAMA, J-A-M-A Psychiatry. Let me give you some numbers, guys, because I like numbers to put things in perspective and really give an idea of how bad this is right now. So first, white people are almost 35 times more likely to have a Suboxone-related visit than black people. To make that number even worse, all this has happened while opiate overdose deaths were rising faster for blacks than whites. So blacks had way more opiate overdose deaths than whites, but the whites were getting way more treatment than the blacks were having access to, right? Another big factor in all this is payment. So a lot of doctors and nurse practitioners that's a keyword, can demand cash payments because there's a shortage of doctors that can actually prescribe the medication. It's a name your price game, right? And right now, for those that can't afford the high prices, usually come from those, more affluent backgrounds, right? You can learn more about that by going to the NPR Boston website. You're searching, the opiate epidemic kind of disparity in drug treatment. All right, next story is just nasty. So hepatitis A. So this one is a nasty story. Hepatitis A cases have increased by nearly 300% in recent years in the U.S., according to a new analysis from the CDC, the Center for Disease Control and Prevention. So Hep A, right, is a disease that is vaccine preventable and the virus affects the liver. It's usually transmitted person to person through the fecal to oral route or consuming contaminated food or water. That's just, ugh. So people actually got shit on their hands and touching stuff and eating stuff. Most adults with Hep A have symptoms including fatigue, low appetite, stomach pain, nausea, and jaundice that usually resolve within 2 months of infection. This one is not due to anti-vaxxers. It's actually due to drug users, right? So all these old school diseases are coming back, making a comeback. First measles, now it's Hep A. What's next, right? So go get vaccinated at your local pharmacy or doctor's office or whatever your preference. In addition to drug users and people who are homeless, those most at risk of infection include people with chronic liver disease, people who have been recently incarcerated, and men who have sex with men. So just be careful out there, guys. And last but not least, the fix is in. This comes as no surprise to me, pretty much. Now, prescription generic drug prices have fixed. So there was a story on 60 Minutes the other day about drug price fixing scandal in the pharmaceutical industry. It's another scandal, one of the many scandals in the industry, right? What else is new? Water is wet. But then I wanted to dive a little deeper and see if there was anything different about the story. Like this sounded like the same old story. So the story is this. Leading drug companies, including TVA, which is the ringleader, Pfizer, Novartis, and Mylan, had an Illuminati meeting and decided to inflate the prices of generic drugs by as much as 1,000%. It reminds me of that Martin Shkreli guy that inflated that drug price for that anti-malaria disease. Remember that a few years back? The guy that brought the Wu-Tang album? Anyways, so they wanted to inflate the prices of generic drug prices by as much as 1,000% while they were over there circle jerking each other. Now, there's a lawsuit from 44 states filed against the companies mentioned. The lawsuit specified that one report found that prices of more than 1,200 generic medications increased an average of 448% between July 2013 and July 2014. These weren't just regular blood pressure drugs. The industry-wide scheme affected the prices of more than 100 generic drugs, including drugs for HIV, asthma, antibiotics, contraceptives, antidepressants, and cancer. I mean, these are drugs, life or death drugs we're dealing with here. So check out the story online, just about everywhere at this point, and see if your medications were affected. In related news, a third of uninsured Americans can't afford to take drugs as prescribed. And it's even worse for diabetic patients who need insulin to survive. A lot of those patients take less than a prescribed dose of the units of insulin because they can't afford the price. Even people that have insurance can't afford it. We're living in crazy desperate times right now, guys. In case you haven't seen the commercials or maybe heard from a friend, if you're having a hard time paying for your prescriptions, try this thing called GoodRx, like GOODR and an X. It's like a coupon to help you save money on prescription drugs. All right. That's all I got for you guys now. Well, one more thing. since it's beach season, it's right around the corner, I want to give you some little guidelines about sunscreen, okay? So choose a sunscreen that is at least SPF 30, broad spectrum, and water resistant. The Skin Cancer Foundation also says to seek shade, especially between 10 a.m. and 4 p.m. Obviously, don't get sunburn, right? Try to stay away from getting sunburn, suntan, and all that stuff. Avoid tanning and do not use UV tanning beds. You want to cover up with clothing, including a broad brimmed hat and UV blocking sunglasses. You should apply 1 ounce, which is 2 tablespoons, of sunscreen to your entire body 30 minutes before going outside, and reapply every 2 hours or after swimming or excessive sweating. Keep newborns away out of the sun, okay? Sunscreen should only be used on babies over the age of 6 months. And for good skincare, you should examine your skin head to toe every month. And if you can, try and see a dermatologist at least once a year for a professional skin exam. All right? A little longer than my usual 10 minutes, but I think everything said was valuable information. Okay, so if you like these small doses, let me know what conditions you want the Spark Notes version of by leaving a comment on Spotify, Podbean, Apple Podcasts, or message me on my Facebook page, Druggie Nation, DRUG-E Nation. And also follow me on IG. That's Emmanuel, EMMANUEL _WOGHIREN. Shout me out there, okay? Shout out to all my druggies, my day ones. Thanks for listening, guys. Hope you enjoyed this episode and that intro, which was funny. Hopefully. We're just getting started. Let's all do something nice for someone else today, okay? And with that, I'm out. Deuces to the next episode.